Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? This is Christian Brindle. Wherever you are and however you might be listening to me today, thank you so much for taking the time. I hope this Monday finds you doing well. I hope you had a fantastic weekend, and I hope you're safe. I hope you're healthy. I hope everything's going great with you, your family, your loved ones in this very unusual and interesting time we have going on in our country right now. With everything locked down with the coronavirus, as of now, I believe we've exceeded over 500,000 cases in the United States of America. And folks, me and my company have been working from home. Everybody, on our staff has been working from home. I've been working from home for probably about a couple of weeks now. And for those of you who don't know who I am, my name is Christian Brindle. I run a company called Christian Brindle Insurance Services where we work with people on their Medicare in 10 states at the moment. That'd be Utah, Idaho, Colorado, Oregon, Washington, California, Texas, Virginia, South Carolina, and Florida. Again, that's Utah, Idaho, Colorado, Oregon, Washington, California, Texas, South Carolina, Virginia, and Florida. And we specialize in Medicare health plans. We work with all of the biggest insurance companies in the industry, and that's why we decided to put this podcast out, folks, because I have seen so many articles, videos on the internet that is just horribly misinformed information about Medicare. Not only that, I've noticed that a majority of people that are turning 65 and getting onto Medicare, and even the people that have been on Medicare for some time, don't really understand what they have, what it does, what it doesn't do, what limitations it has. And I've always kind of made it my mission, if you will, to effectively eliminate that, to kind of put the power in your hands, so that way you can make a better, more informed decision. With everything going on with the virus, my wife and I, have been basically stuck at home. We really haven't left the house much. Maybe for a walk around the block here or there. Drive-thrus are still open, so once in a blue moon, we might go through a drive-thru, get some dinner if we're getting tired of what we have around the house. And we try to make sure that we do everything we can as safely as we can to get my daughter out of the house, who's 11 months old now. Just because I don't think it's good for her to be cooped up all day, every day, but at the same time, we're not being stupid. We're trying to make sure that we're getting her out of the house in a safe manner to where she's not at the risk of being exposed. And because we've been spending so much time in the house, obviously I've been working from home, but obviously, I've been around a lot more than I usually am because of that. And, but we've been watching, some documentaries. My wife and I really enjoy watching documentaries. And we watched this documentary in the last week or so called Enlighten Us. It's a story about James Ray. If you're not familiar with who James Ray is, James Ray was a participant in the movie The Secret. Many of you might remember The Secret. It came out in about 2005. It's heavily based on this whole law of attraction theory, right? You think good things happen to you, right? Whether you believe in it, don't believe in it, agree with it, disagree with it, think it's the greatest thing in the world, or think it's a bunch of hocus pocus, is irrelevant to me with the point I'm trying to make with this. But basically, for those of you who don't know the story of James Ray was invited to, become part of the Secret movie. And obviously it was, endorsed by Oprah at that time in 2005, 2006. Any book, any movie, any project that was endorsed by Oprah would basically blow up. James Ray was a motivational speaker, and it basically exploded his career overnight. And he started taking people to these retreats. I don't want to spoil too much about the documentary for you because I do recommend you go watch it if you haven't already. It's actually very, very fascinating. Big look in the, self-help, motivational speaking world. They do talk about the origin of it and everything like that. But in a nutshell, James Ray would take these people to retreats. He'd charge them $10,000 to do so. And part of the retreat was basically pushing them to their limits to try to let them have quote-unquote breakthroughs. And with these breakthroughs, he thought that they'd become stronger, better people, they'd be able to do more things. And one of the things he would do to push them is he had this dome-like thing that he would call a sweat lodge. Some of you might remember hearing about this on the news. This actually happened in 2008, 2009. I don't remember the exact year. And he would bring people into the sweat lodge, and he'd keep them in there for, I don't know exactly how long, maybe 10 minutes, 20 minutes. And the documentary stated that the heat levels in there got to about 140 degrees. Sound like a bad idea to you? It did to me, before I even knew what would happen. I didn't hear about this on the news. I was completely going into this blind. And basically what happened was 3 people died. 3 people died. Countless others were in critical condition. James Ray went to prison for a minimal 2 to 3 years at that. If you watch the documentary, he got off pretty light if you think about it. For 3 lives. Was it on purpose? I don't believe so. Was it an accident? I think so. But 3 lives. But the point I'm trying to make here is this. We get so drawn in our lives to gurus. No matter what it might be. It might be financial gurus. It might be health gurus, exercise gurus. And I do believe that we've come to the point where now we have insurance gurus, Medicare gurus. And when those insurance gurus and those Medicare gurus paint a narrative for you, through videos online, through leveraging their massive followings, and you could even make the argument that I'm an insurance guru. I won't, deny the fact that I've kind of become that in the last couple of years since we've really started putting out incredible content that nobody's matched out into the marketplace. But I do believe that when it gets to the point when you're blindly following gurus too much, and that includes me, I think you're kind of putting yourself in a position where they're at some point going to take advantage of you. My dad always said in the business, if you bend over too much for people, that you might get screwed. Excuse the terminology. I know it's not very politically correct, but I think it's always, held true to me. And not just in business, but in life. And there's so many of these gurus that exist today on the internet that basically demonize the Medicare Advantage plans. They demonize them. They say they're no good for anybody. People need to be on Medicare supplements every single time. And I've made my stance clear. I've said from the very beginning, you need to look at both sides of the spectrum to make a better, more informed decision on what you might want to do. And you need to do it with an unbiased, blank slab approach. Some people do that. A lot of people do take my advice on that, but other people, they hear Medicare Advantage is bad and Medicare supplement is good, and they completely make that position in their mind and they never back off of it. And that's what I believe is dangerous, because I believe Medicare supplements have a place for people, and there's a lot of people that need to be on them. I believe that Medicare Advantage plans have a place for people, and there's a lot of people that need to be on them. And in this episode, I wanted to talk about exactly what you can do to be in the best possible case if you're on a Medicare Advantage plan. What's the combination of benefits you can look for and attach into your coverage to be covered as well as you could be on a Medicare Advantage plan? I'll call it the Cadillac coverage. I have to take a quick break here from this week's sponsor. I'll be back in segment 2, and I'll tell you exactly what I'm talking about. Don't go anywhere. Welcome back, everybody. Thanks so much for sticking with me through that break. Folks, let's get into the perfect combination of policies you can have without bankrupting yourself, number one, or being insurance premium poor, or without getting yourself in a situation that you're going to be left with a gap. So one thing we know about Medicare Advantage plans, the argument against them is this. Medicare Advantage plans leave more out-of-pocket behind than Medicare supplement plans do, right? That's the argument. Medicare supplement plans, you pay a higher premium, but you have the best medical coverage money can buy, little to no out-of-pocket depending on the type of plan that you pick up, right? Plan G has a one-time-a-year Medicare Part B deductible it doesn't cover. That's $198 one time a year. That's the only medical out-of-pocket someone should pay as long as what they're getting done is covered by Medicare first, right? Whereas with Medicare Advantage plans, you pay a much lower premium, and you're in a situation where you have medical out-of-pocket for almost everything that you use it for, a lot of things, and the copays can add up quickly, right? That's the argument against it. So if I'm working with somebody that's chronically ill, someone that has a lot of health conditions, or maybe even someone that just wants to have, top of the line coverage, I'm always going to recommend to them that they pick up a Medicare supplement regardless. But what about the people that aren't that unhealthy? What about the people that don't have those kind of health problems? But at the same time, they still want good coverage. They don't want to pay through the nose in premium. Well, this is the best alternative for them. And I believe every single person on Medicare Advantage should have this combination of coverage in order to fill in the gaps and the holes of the Advantage plan. So what do we know as far as the few largest gaps we have with Medicare Advantage plans? Well, what we know is Advantage plans typically charge 20% coinsurance for kidney dialysis, and they typically charge 20% coinsurance for high expensive injectables, chemotherapy, injections, those kind of things. They call them Part B drugs in the Medicare world. Part B as in boy. Most Advantage plans are going to pay 80% on those two aspects and have you pay 20%, which is a huge amount, 20%. Kidney dialysis is a gigantic expense. Chemotherapy is a gigantic expense. Now, Medicare Advantage plans do have max out-of-pockets, so they do have that. They have safety blankets to ever prevent you from paying too much in a calendar year. But sometimes those max out-of-pockets are $4,000 a year, $5,000 a year, $6,000 a year. And sometimes a lot of people don't have that kind of money they can just drop if they had something really horrible come up. Now, they do give you great coverage, all things considered, because a lot of times those treatments themselves can cost hundreds of thousands of dollars, and if they pay everything except for $4,000, $5,000, $6,000, you're still in a pretty good spot. But what can you do? Well, in a lot of markets, they have $0 premium Medicare Advantage plans. Some don't. If they do have premiums, typically you're going to be looking at $20, $30 a month in premium. But let's just assume you're in a market, like probably 90% of the audience is, that has a $0 premium Medicare Advantage plan. So you have a $0 premium Medicare Advantage plan. Let's say, for example, you have a $5,000 max out of pocket. The other big expense that can come with Medicare Advantage plans is the hospital copays. Typically, depending on where you live, you're going to be looking at anywhere between a $200 to a $400, somewhere in there, dollar copay per day in the hospital for days 1 through 5. Per day. Now, that being said, it's really not too bad if you think about it, because usually the average hospital stay is anywhere between $5,000 to $10,000 a night in the hospital, depending on what they're doing. So if you're paying the $200 to $400 copay per day and they're paying the rest of the $5,000 to $10,000, not in too bad of a spot. Medicare Advantage plans, folks, are very unique from the standpoint that that copay includes everything that happens to you in the hospital. All the doctors you see, all the doctors you don't see, the hospital room, the bed, the walls, the ceiling, the anesthesiologist, if they give you an aspirin, the IV in your arm, everything. It's all condensed into one copay, Whereas with most health insurance plans, they bill you separately for each little thing that happens to you, but not with Medicare Advantage plans. So if you go in the hospital, truly the only thing you're going to pay is that $200 to $400 copay. But that can be a large expense. If you spend a week and it's a $300 copay and they charge you for 5 days and then they pay everything after day 5, well, you're paying the $300 copay for 5 nights and you're going to be looking at $1,500 out of pocket. And all things considered, that's not too bad. A 5-night hospital stay nowadays probably is going to cost you at least $50,000-$60,000 without insurance. At least. So the fact that you can walk out paying $1,500 and that's it, you're not in too bad of shape. But what if you want the best possible coverage you can get? Well, those are the two medical holes you have with Medicare Advantage, right? Cancer. The other thing, hospital stays. The other thing you have, and this is not just a Medicare Advantage thing, this is a Medicare thing. Medicare supplements are no better in this situation, is long-term care, such as, assisted living facilities, nursing homes, things like that. Those are places that are tremendously expensive. They probably are anywhere between $5,000 to $10,000 a month to live there. But some people get to the point in their lives where they can't live on their own, and it's better for them to live in those kind of places. Nobody wants to think about that, but it's something we need to think about at some point. Now, Advantage plans will cover you for the first 100 days in a place like that, under skilled nursing. So will Medicare and Medicare supplements. The difference between Medicare supplements typically and Advantage plans is Medicare supplements will pay everything for the first 100 days. Medicare Advantage plans will pay everything for the first 20 days, and then after day 20, they usually charge you a copay per day. Usually it's $100 a day, $150 a day, depends on the plan and depends on where you're listening from. So what can you do? Well, this is a way you can beef up your Advantage coverage, have very good coverage, without paying through the nose in premium like you do with a Medicare supplement. You pick up a $0 premium Medicare Advantage plan. Of course, we've talked in nauseating detail in this podcast what you need to look for. You need to cover your medications as well as possible, need to have all your doctors in the network, and need to have low copays if you can help it. Some dental, vision, hearing coverage doesn't hurt either. So we have this $0 premium Medicare Advantage plan. You're not paying anything for it. There are 3 plans you should be picking up that go with your Advantage plan, in my personal opinion. Even if you're healthy as a horse. Because no matter what happens to you, you're going to be in a top-notch situation and scenario. Number 1, you want to pick up a hospital indemnity plan. Hospital indemnity plans can run you anywhere between $20 a month and $40 a month, depending on what you want it to do. But typically, they're designed to come in and pay some of, if not all of, your hospital copay overnight in the hospital. Some of them will pay the provider directly. Some of them will reimburse you. But they will pick up a portion, if not all, of your hospital copay a day. And they're customizable. You get to design it. So you can basically, set it up to where, let's say your copay is $300 a day in the hospital. You can set it up to where it pays $200 a day, or $250 a day, or $300 a day if you wanted to pay it all. I always recommend putting an ambulance rider on there. Usually Advantage plans charge $200 to $300 to $400 copay for an ambulance ride, depending on the plan. So why not throw an ambulance rider on there that pays $200 to $300 of your ambulance? You don't have to worry. There's hospital out of the way and ambulance out of the way. You can also throw in skilled nursing if you want to, but the more you add on to a hospital indemnity plan, the more expensive it's going to be in terms of monthly premium. So let's say, for example, you're paying $30 a month for your hospital indemnity plan. 30. So there we go. The next thing I believe that people should add is cancer insurance. Cancer insurance is actually good whether you're on a Medicare supplement or a Medicare Advantage plan, because there's 2 sides to cancer expenses. There is the medical treatment that comes with it, and obviously that helps with a Medicare Advantage, not with a Medicare supplement, because with Medicare supplement you don't have medical out-of-pocket or very little. But it's also the Medicare Part D side of things, the drug costs, the Tier 5 medications that can cost $20,000 a month without insurance and still end up costing you $2,000 a month, $3,000 a month in drug costs. That's tough. A cancer plan can usually cost you $20 to $30 a month, and it will cover you for the prescription out-of-pocket, but also the medical out-of-pocket. So now we're at $60 a month. Let's say cancer policy is $30 a month. $1 a day. We're now at $60 a month. The next thing I typically recommend is a short-term care policy. Short-term care policies will typically pay for up to a year in an assisted living facility. Now, I know people say, well, what's the chances of me being in there longer? You never know. But that being said, the only other option to a short-term care policy is what's known as a long-term care insurance policy, which those typically cost $200 to $300 to $400 a month in premium, depending on your health, your age, and how good you want it to be. They'll pay for 2 to 5 years in a facility. But you can typically get a short-term care policy for $30 to $40 a month in premium and have it pay for up to a year in a facility. So let's just say that's $30 a month. Could be more, could be less, depending on how good you want it to be. We're now at $90 a month. You're completely taken care of for hospital coverage, ambulance rides, cancer, and assisted living facility coverage. And with that alone, you're paying $90 a month in premium. But in some markets, you can pay $200 a month for a Medicare supplement, $250 a month for Medicare supplement, maybe even $150 a month for Medicare supplement. This is how you beef up your coverage for Medicare Advantage plan and close the gap between Medicare Advantage and Medicare supplement as far as coverage is concerned. By having that cancer policy, you're better covered for cancer probably than you would be with a Medicare supplement because of the drug costs. By having that short-term care policy, you're covered better than in an assisted living facility than you would be with Medicare Supplement. Remember, Medicare Supplement and Medicare stop paying after day 100. But a short-term care policy could pay 6 months, 8 months, 9 months, a year if you wanted to. Don't go anywhere, folks. I have some final thoughts I'd like to share with you on this. Hear from our sponsors this week. Take a quick break, and I'll be right back. Don't go anywhere. Welcome back, everybody. Thanks so much for sticking with me through that break. Folks, the point I'm trying to make with this is you can have great coverage with Medicare Advantage plans without having to pay the premium of a Medicare supplement. And all of these, jokesters on the internet that basically paint the picture that it's Medicare supplement or bust, and Medicare Advantage has no place. Obviously, those people, don't have your best interest in mind. They're clearly biased. They clearly swing to one side of the pendulum and don't even have the interest in giving you the choice of picking what's best for you. I had Scott Huser on Saturday, and we did an interview. For those of you who don't know who Scott Huser is, and if you missed that interview, I really encourage you to go back and listen to it. It was fantastic. One of the best ones we ever did, I think. But Scott Huser is someone that I've known since I started in my career. Scott Huser was the United Healthcare market manager here in Utah for years. And he went off and started his own insurance agency, and he's doing very well. But he's always been very smart, very articulate, and just someone I have so much respect for in the industry. And he said something that really jumped out at me on that podcast. I was going back and listening to it. I was listening to our shows after they air, just because I want to make sure that we did a good job. I want to just hear how we sound. But I don't listen to it before we go put it up, ironically enough. But he said something on that interview that really jumped out at me. He said, "It's your health. It's your health. It's your decision." And he was basically talking about why it's so important to have an agent that shows you both sides of the coin equally and explains it to you without any biases, without trying to point you one way or another, and lets you make the best decision for you by telling you the good, the bad, the ugly of both. And I agree with that. He said, it's your health. It's your decision. You're the one that needs to be able to make a more informed decision. And you can't do that by just working with someone that's only going to show you one side of the coin. They have no interest in you. They only have an interest in what's best for them. And it's easier for an agent, I've said this many times in this podcast, it's easier for us as agents to sell Medicare supplements. There's less work for us to do, less customer service. They're all the same in every state. It's a lot easier for us as an agent to sell Medicare supplement. If I had the choice, if all things were equal, I'd rather sell a Medicare supplement than a Medicare Advantage plan. But I sell more Medicare Advantage plan than I do Medicare supplements due to the fact that they're probably a larger portion of the people I work with, it's better for them than it would be doing a Medicare supplement. So I put my own personal feelings aside. And in an age and a day where gurus pop up about everything, there's a guru for everything. Like I mentioned in segment 1, health, fitness, gym, makeup, insurance, Medicare. You don't want to blindly follow gurus too much. You ever hear the old saying, don't drink the Kool-Aid? Don't drink the Kool-Aid on Medicare supplements too much. They're great, they're fantastic, they have their place, but they're not for everybody. Medicare Advantage plans might be better for some of you than Medicare supplements. Medicare supplements might be better for you than Medicare Advantage. Just know they're not created equally, they're both different, they both have their strengths and weaknesses, and don't drink these gurus Kool-Aid. I can't talk today. Don't drink these gurus Kool-Aid. Because if you do, you might end up, metaphorically speaking, and from an insurance standpoint, in a dome that looks like shit in the middle of nowhere in the desert, cooking to death in 140 degree temperature insurance-wise. You might be left out in the cold is basically what I'm trying to say. And yes, you might be thinking of it and be like, oh, it's like a cult thing, the documentary that I watched. Enlighten Us, the story of James Ray. A lot of these people were pretty bright, it seemed like. It's very easy to get caught up and think that these gurus know everything and that these gurus are not wrong about anything, they're perfect, They have not a flaw on them. And we're all human. So just keep that in mind. We're all human. Nobody's right about everything all the time. And these gurus are wrong more than they're right, as someone that's been in this business a long time. I don't even want you to look at me as much as a guru. I'm someone that's been around the business. I can share my experience with you. But I always come from a perspective that, hey, look at your options. Look at your choices. Make the best decision for you. This is what you need to know about both sides. Make the best decision for you. I'm never pointing you one way or the other. I want to give you the tools to make the best decision for yourself. And that's when you're going to feel good about your situation, when you understand what you're picking, you understand why you're picking it, and you understand the other option that you had available to you as well as possible. Folks, thanks so much for listening today. Thanks so much for being here with me. As always, if you enjoyed the show, please do me a huge favor. Drop a 5-star review on it if you're listening to us on a platform that allows you to do so, such as Apple Podcast, Stitcher, and write something that you enjoyed about the show. I always love hearing from you. If you're watching on YouTube, please don't forget to subscribe to the YouTube channel for future videos. We put out plenty more content than just the Everything Medicare podcast on YouTube. We put all kinds of videos out. And as always, folks, if you live in one of the 10 states that I mentioned in segment 1 and you'd like to do business with me, if you'd like to talk with me about your Medicare health plan, my office number is 801-255-5340, 801-255-5340, or you're welcome to shoot me an email at christianb@xmission.com. Christian, Christian, B as in boy, at X, like an X-ray, mission, mission.com. christianb@xmission.com. Thanks for being here, folks. Talk with you again on Wednesday.